Welcome to this interview for the Society of Sports Therapists. I'm Christian Weaver, and today we're joined by my friend, colleague, and society member, Kirsty Hogood. Kirsty has enjoyed an exciting career as a sports therapist who actually faced an immense life challenge and has since gone on to join Edge Hill University as a senior lecturer in sports therapy. So, Kirsty, can you tell us a little bit about your sports therapy career so far?
Okay. Hi, Christian. Thank you for the lovely introduction. So my career so far, I'm going to start actually from the very beginning. I did my undergraduate degree at the University of Chichester back in 2010. And from there, I went on to work as a sports therapist. So I've been a member of the society since. And I started off mainly working in football, a little bit of private practice, and started doing a little bit of kind of clinic supervision work at the University of Gloucestershire, and essentially built from there. Found my way into ice hockey, started developing within a teaching environment, so became a lecturer at the University of Gloucestershire. That's actually where I also did my master's. And while that was going on, I also worked evenings and weekends. Kind of ice hockey became my sport, it became my love. So I worked with England, I worked with GB, and then I also worked privately. Then in 2018, I actually made the decision that I wasn't done with full-time clinical practice, and I actually left education for a little while. I moved to Austria and worked for a company called Alpine Sports Physio, where I worked as a full-time sports therapist for that company. And then kind of had a career break for the reason we'll explain in a moment. And now I can be found lecturing at Edge Hill University.
Okay, excellent. Thank you for that. And you sort of touched on why you may have had a career break. So if we just go to August 2019, you're actually diagnosed with cancer. Would you mind just telling me a little bit more about your diagnosis and what it actually meant for you?
Yeah, of course. So my primary diagnosis was primary bone cancer. So I had what is known as an osteosarcoma. And it's actually quite a lengthy story. So I'm going to give you the highlights of my diagnosis, because mine actually started with a musculoskeletal injury. So back in 2016, I actually had a netball injury where it actually meant I missed my playoff finals. But I sprained my ankle, had pain on distal fibula, went to hospital and had an X-ray, and was sent home. And X-ray was clear, and it just didn't respond like you'd expect a lateral ankle sprain to, in terms of 5 days later I was still non-weight bearing. I had significant bruising. It was very extensive, and A&E actually phoned me back several days later and asked me to come back in. And long story short is I was referred to a trauma and orthopedics. Something had been seen on my X-ray. I then had MRI scans, and I was diagnosed with, at the time, what was termed a lytic lesion or a benign lesion. And kind of from there, I had several appointments. So across the next few years, kind of several appointments, several conversations. And that then led me to 2018, when kind of, when did it happen? So 2016, I had my injury, and I was back playing netball within 6 months. I was quite happy playing my netball, and I was back at work. I had no functional deficits. I was happy with that. Then in 2018, I started getting some symptoms in that leg. So the main symptoms for me were heat. So I had heat on that side of the leg, but to a point where I didn't quite believe it myself. I was actually getting colleagues to touch the outside of my leg and go, "Does that feel warmer to you?" Because you almost convince yourself you're going mad. And then I was also getting a bit of pains, but it was pain. If I'd had a busy day or if I played netball, it was pain at night or pain the next morning. So it wasn't that mechanical style pain. So I went back to the orthopedic centre. And again, I was actually immobilised. We had more scans. And again, it was kind of like, no, we're quite happy with this. The options are either we go for a surgical option where, we basically take out the affected area and bone graft, or we leave you alone. And I went, well, the pain isn't that bad. I'm still playing netball, I'm still walking around. I'm overjoyed that this is benign, happy days, let's carry on. And that's exactly what I did. I then, carried on with my life. I was working in Austria, I was thoroughly enjoying myself, but the pain started to creep a bit more. So by May 2019, it was so significant, I wasn't able to do my activities of all my exercise. So I couldn't run, I couldn't play netball. The pain was actually just it was just getting too much. So I thought, okay, I'm going to have that surgery they offered. So opted for the surgery, and again, long story short, eventually was referred to a sarcoma centre. So there's a few sarcoma centres in the UK, one being in Birmingham, and that's where I was referred to. I then had a biopsy, which probably about 2 weeks or so later, maybe possibly 3, I was working in a private sports injury clinic in the UK, and I got a phone call between clients to diagnose me with my high-grade osteosarcoma, which came as a bit of a shock. I think I say my world came crumbling down. It came crumbling down for 15 minutes. And then I went, okay, compose myself, got another client, saw my client. And then I went back to then going, okay, what am I going to do about this? What does this mean for me? And actually what it meant was, the immediate things had to be sorted. So things like I had just been offered the SST scholarship to VCU about a month before. So it was things like calling the Society of Sports Therapists and actually speaking to Graham and saying why I'm going to be unable to go. I had a trip booked to India that was cancelled. I had a new job role at another institution that unfortunately the offer had to be withdrawn because I wasn't able to start it. It meant no income because at that point in time I was self-employed. It meant no sport. It meant moving in with my dad, and it meant just a very unknown time for me, my life, and my career, really.
Yeah, and obviously with that sort of uncertainty, you're also facing having to look at treatment. And so what kind of treatment did you then undergo in order to try and beat this cancer?
Okay. So the treatment pathway is relatively complex. So I'm going to do my best to simplify it. And the first thing that happened is I was actually immobilized. So the very first thing was sticking me into a cast, where there was quite a bit of debate as to whether I was going into a weight-bearing or non-weight-bearing cast. And I'm very fortunate that we eventually discussed a weight-bearing cast. And that was there to essentially stop me breaking my leg. So stop a fracture occurring and stop any damage occurring to that tumour. It was, we had scans to make sure it hadn't spread anywhere. And again, I was extremely fortunate that my scans showed that it appeared that it was just localised, which came as a huge relief. And then it was a case of starting the main bulk of it, which is chemotherapy. And then I had a surgery in the middle of my chemo. And then I had a targeted drug that was called mifamertide. So I'm going to talk about all those separately. And I'm going to start with the chemo because that's where it all started, really. I had something known as a MAP chemo. So it is a high dose chemotherapy regime, and you are treated as an inpatient. And it runs across 5-week cycles. So I would go into hospital and it essentially be attached to a machine for anywhere between 3 to 5 days. And that's day and night. And that would happen for 3 weeks in a row. And then I would get 2 weeks off and I'd get to go home for 2 weeks. And the first cycle, so kind of I went into hospital for 3 days, a couple of days out, hospital 3 days. Hospital 3 days, a couple of days out, hospital for 5 days, a couple of days out, then hospital for 5 days again, a couple of days out, then 2 weeks off. And the first time I thought, yeah, I'm handling this really well. This is okay. I had all the side effects that you expect with chemo, but I thought I can I can handle this. And after cycle 1, it turns out I couldn't really handle it and it became much more challenging. And those 2 weeks off became times where I'd be quite poorly and I'd end up as an inpatient in hospital having, whether it be blood transfusions or platelet transfusions, or, you know, it was a lot of time as an inpatient for my chemo regime. So after 2 cycles, so anywhere between 10 to 15 weeks, and for me it was around 11 weeks after starting chemo, I had my surgery. And I had a couple of surgical options. So my surgical options were, number 1, talocrural joint fusion. So remove the distal fibula and have the talocrural joint fused, because obviously the distal fibula stabilizes our ankle and has ligament attachments that stabilize that lateral side. And I was going to have that taken away, because I probably didn't explain, actually, my tumor was in my distal fibula. So it was in the lower end of that fibula, which complicated surgery a little bit, because if it's in the middle of the fibula, fine, you just get rid of that bit. But the 2 ends of the fibula are actually quite important, and I was losing one of the ends. So one option was talocrural joint fusion, and the other was a below knee amputation. So at the time we went with the fusion, and I sat with my surgeon. I remember being in floods of tears and essentially saying, are there no other options? You know, both of these options were going to leave me with, you know, quite poor functional outcomes. And as a very sporty, active person, I you know, was going to push for any other options that were available. And at the time, the answer was no, these are the options that we've discussed. And then 6 days before my surgery, my wonderful surgeon actually gave me a phone call to say, we've got another idea. And essentially their plan was to do a lateral reconstruction, and it was using something called an Arthrex speed bridge. And I have a very limited understanding of this, but my understanding is that the Arthrex speed bridge is usually used on rotator cuff repairs. So obviously, if you compare a rebuild the outside of your ankle to a reattach a muscle tendon unit, it's very different. So they weren't quite sure how that would work. However, I've been extremely fortunate in the fact that the functional outcomes have been more than I think anyone ever expected. So I'm grateful every single day that I got that surgical option. 3 weeks after surgery, it was time for more chemo. So they do chemo before to essentially try and kill as much of the tumor as they can. Then you have your surgery to remove that tumor. Then I had chemo after to essentially mop up any cells that might have been left. And again, it just got harder and harder. So as you carry on, your body gets weaker and weaker. So again, it was more time as an inpatient. Again, repeated admissions to hospital, and rehabilitation of my leg was definitely not a priority at that moment in time. It got to when would it have been? March 2020, and obviously the COVID pandemic came in. So just to add an extra level of complication to my treatment pathway, it was actually decided my body really was starting to struggle, and the risk that COVID was to my life was probably more than the cancer at that point. So the risks of continuing chemotherapy outweighed the benefits. So therefore, I had to stop treatment 8 weeks early. So it's about, well, it essentially, like I said, 8 weeks early. And that's, at the time, it was about four extra doses of my chemotherapy. And that, being honest, was the hardest part of my treatment, which sounds bizarre because you've just had someone tell you you're no longer going to have a treatment that is making you so poorly and so unwell, and it's stopping you doing the things you love. It kept me from my job. It kept me from everything. And I've been told, we're going to stop that now. We're going to stop making you feel awful. But at the time, all you want is your chemotherapy, because you go, we had a plan in place, and I'm not finishing that plan. And that plan is based on research, and the research says this is what you should receive, and I'm not receiving that. And then that worries you even more than you may have been before. So yeah, that was tough. That said, I was then lucky to receive a targeted drug. So there's a targeted drug that people with osteosarcoma sometimes receive. It's called mifemertide, and it's 48 doses. So and it's delivered as an outpatient. So this time I didn't have to stay in hospital to receive it, and it's much less potent than chemo. The side effects are less severe. The side effects are more short-lived. My hair started growing back. I began to get more brain power, a little bit more energy. Everything slowly started to build back up, and that was quite nice. But then that led me to finishing my active treatment in October 2021.
Wow, thank you very much for sharing all that. Obviously, it demonstrates that you're obviously a very resilient person, probably both physically and both mentally as well. But you may have had a network of people who helped to support you as you went through. So do you want to tell us a little bit about that network?
Absolutely. And you know what, this is genuinely, I mean, I obviously had my friends and family, and they were unreal. Especially my dad. He was my carer. He looked after me at home. But beyond that, I had a network within sports therapy, and I would say without my job, I wouldn't have had, or without sports therapy, I wouldn't have had the amount of support that I got. So I'm actually going to start with the SST. So from the moment I was diagnosed, I phoned the SST because I also needed to let them know not only that I couldn't go to the scholarship, but also what was I doing with my membership? What was I doing with my insurance policy? And you know what? Very hassle-free, exactly what you need when you've got other stresses going on, the ability just to email and speak to someone and them go, it's sorted. Like, don't worry about it. And then, the SST were great in terms of just checking in with me every now and again. And that was lovely. And then beyond that, you've then got the fact that you've worked in sport. And I'm sure you all know that when you work in sport, you end up with, almost an extension of family in some places. So an example of that is GB ice hockey. So the women's team put on a charity ice hockey game where they raised quite a significant amount of money, and it was an incredible day. A lot of the players that I had looked after, treated at some point from their maybe under 13s at England right through to GB women, actually ran this game. So that was amazing to have kind of that external support. And then alongside that, I had private clients that and ex-players that raised money for Sarcoma UK by doing fun runs or burpee challenges. They raised money for the Bone Cancer Research Trust, again, with things like burpee challenges, people dyeing their hair crazy colours. My boss from Austria in Alpine Sports Physio also raised some money for me. I had, what else went on? It was just the fact that old teams were willing to come in and go, oh wow, you're not very well. And it wasn't necessarily all about me, but the fact that they would go, we want to raise some money for charity, who would you like to raise it for? And from that, we've raised significant amounts for those charities that are now quite important to me. And just being surrounded by that community was amazing. And I do actually want to make a specific mention just to Kate and Katie, who know who they are, because having some colleagues and friends that then would just talk to me about clinical case studies or run a couple of online CPD sessions during COVID lockdown about things that they had recently done or seen kept my head in the game. It meant I didn't drift away, because being honest, without that, I honestly feel like I would have drifted away. And I'm not entirely sure I would have come back to this profession, because it is very hard having a few years out for something quite life-changing and then trying to come back to it is very challenging. And I think having the support from the sports therapy community made me go, wow, I had an amazing job with amazing people. And then having colleagues, you know, support me by talking to me about those case studies or running CPD, or actually even one of them shaving her head when I lost my hair. You know, that was so beneficial. And I think I think if I didn't have that, I'm not convinced I'd be back in the career path I'm in now.
Yeah, it's interesting that you've said about all those different networks. It's not just one specific network that you were surrounded by, and even the fact that other players that you previously treated had sort of had you in such high regard that they were willing to do all those things to help support you in that way. So that's fantastic. Obviously, a great impression that you must have had on those players as well during the time working with them. So it sort of brings me on to the actual surgery that you had, and how you then started to think about rehabilitation. You've obviously got a vast sports therapy knowledge, which you may have been able to tap into too. So do you want to just tell me a little bit more about how you maybe used that knowledge to help yourself rehabilitate after having your ankle surgery, and try and get back to some of the things that you enjoy doing?
Yeah, absolutely. So first of all, I'm going to say it's very hard to listen to your own advice. Any sports therapists that are out there that have been injured or are injured, it's hard. And as a sports therapist, I obviously didn't really know the limitations that chemo would give me. And in fact, as a sports therapist, my knowledge of cancer is extremely limited. Or was limited until I had personal experience of it. So I guess some elements were challenging, because as a sports therapist, I'm ready to start rehabilitation as soon as I no longer have to immobilize. You know, I'm ready to do things as soon as that healing process allows me to do them. And I didn't take into account that I'd be on chemotherapy. So it is more challenging. You don't have the energy levels. You know, I had great plans of maintaining all of my hip and core musculature while I was immobilized. And yeah, no, that didn't happen when I was on chemo. So I maybe didn't take that into account. But as soon as I started feeling well again, and I was out my cast, I'm very pleased I had the knowledge base I had, because it was during lockdown. In particular, there weren't any face-to-face appointments. There wasn't much physio care. You know, that element wasn't going to be a priority during the COVID lockdown. So I look at that and go, I'm extremely fortunate because I have the knowledge base to rehabilitate myself. So as soon as I was out my cast, I was in my house 2-3 times a day. Once chemo finished, and I was doing in my intrinsic foot muscle work, I was building myself from non-weight bearing to partial weight bearing to full weight bearing. I was using a complex on other parts of my limb to kind of keep that moving, keep it nice and relaxed, relax my other leg because it was being overworked. You know, all that sort of stuff was really beneficial, because I think once you have that knowledge base, you forget, you know, if you don't know how to go from non-weight bearing to partial weight bearing to full weight bearing, you're waiting for somebody to tell you when and how to do those things. And if you're in a COVID lockdown, you haven't got that person to do that. So I was fortunate in the fact that I could do that. And it was quite nice, actually. I had a telephone consultation with my surgeon where he said, hey, you know, how's the ankle feeling? I said, well, you know, it's quite stiff, and you know, the dorsiflexion is very restricted, so I can't really get downstairs very well. And he just went, hang on, are you walking? And I said, well, yeah. And I think it's just the ability for you to be able to progress yourself. It was unbelievably beneficial. And you know, like I said, my functional outcomes have been incredible. I'm very, very pleased with it. And I do put a lot of that down to my surgeon and pushing for something different to give me those functional outcomes. But at the same time, you have to rehabilitate to make sure that you're then strong and you can balance. What I find hard now is as a sports therapist, I want to push to be back to the same level or stronger than I was before. And, it's being able to listen to somebody that has surgery and listen to them when they say that's not a good idea because we've got a material in there that hasn't been necessarily devised for what we've used it for, so we need to be cautious. The last thing we want is for essentially the talocrural joint to start collapsing. So now it's that fine line between me being a sports therapist that wants to achieve and me being a sports therapist that is going to listen to what I'm being told.
Yeah, absolutely, and that's where the power of the multidisciplinary team comes in. I think in some ways, obviously, we have our scope of practice and we're very good at that. But obviously, listening to those who work with those materials on a daily basis is quite important, especially when we're talking about certain factors of how they've been tested and whether it can actually withstand what you want it to do, Kirsty. So,
And
sort of reflecting upon that experience that you've had, then what do sports therapists need to be aware of when assessing injuries that potentially may appear abnormal or outside of what they would typically see?
yeah. I think the first thing I'm going to say is, as sports therapists, we are not trained to identify a cancer. So it's not that we're trained to go, oh, this person might have cancer. What we're trained to do is recognize when something doesn't meet a mechanical pattern and be able to clear our red flags. So for me, I was having heat, unexplained heat, and pain that didn't fit a mechanical pattern. So it is a case of just make sure you know your red flags, and make sure that if it doesn't fit, if it doesn't appear like it's some kind of mechanical problem, then you need to refer. And I would say when you refer, because for me, I had been referred, I was under that level of care. And as a patient, you definitely sit there and you want the best news possible. So if you're being told something is benign, you're certainly not going to question that. You're going to go, oh, thank God for that. Great, I can carry on. So you, as the kind of therapist, I would say that's your moment to go, this still doesn't seem right. This still isn't a mechanical pattern of pain. And you know what? Don't be afraid to send somebody back with a letter to express exactly what the red flags are and why you are concerned in relation to that. It doesn't fit a clinical pattern of a musculoskeletal injury. Or case conference with colleagues, or like you said, that multidisciplinary team becomes quite important there. So I think, recognizing red flags and recognizing when something doesn't meet a mechanical pattern of pain is really important. I think it's probably also important to note that the type of cancer I had in particular, so primary bone cancer, so whether that be an osteosarcoma or a Ewing sarcoma, is really it's not common, it's a rarer cancer, but it's more likely to occur in younger athletes. So you're looking at under the age of 24. So those of you that are working in academies, it's probably something, the signs and symptoms are something you should be aware of. And this is where I'm actually just going to direct people to a resource. So the Bone Cancer Research Trust, if you go to their website, they actually have some really nice flashcards that were originally designed for physiotherapists, but the information on there is very, very useful. So it would be worth having a look there. And Sarcoma UK also have some useful information. So they're two charities that, if it's something that you want to look more into, that's where I direct you.
Fantastic, Kirsty. And yeah, there are those kind of resources out there for sports therapists to look at as well. So thank you very much for sharing your story with everyone who's watched or listened. And we really appreciate you openly sharing your experiences on what must have been a really challenging time for you. And a challenging time in your sports therapy career. But I look forward to continuing to work alongside you, particularly as a member of the Society of Sports Therapists.
Thanks.